and other nations to share the resources and caretaking of this land. Toronto is home to many Indigenous peoples from across Turtle Island. Earlier this year, Stats Can released a report titled Year in Review that uncovered data affirming that the most racially diverse neighborhoods in Canada reported COVID-19 mortality rates more than doubled in those neighborhoods that are overwhelmingly white. The report accounts for deaths between January 2020 and January 2021. Mortality rates for women in these same neighborhoods were 3 times as high as those living in predominantly white neighborhoods. Unfortunately, these statistics tell us what we already know, that racialized communities have higher rates of COVID-19. However, what these statistics do not capture are that these higher rates led to the blame and stigmatization of racialized communities for the spread of COVID-19, when this spread was actually due to the impact of systemic issues. To discuss this topic of blame and stigmatization today, we're joined by the following panelists. I'd like to introduce Avi Go, Clinic Director of the Chinese and Southeast Asian Legal Clinic, Arif Virani, Member of Parliament for Parkdale High Park, Doly Begum, Member of Provincial Parliament for Scarborough Southwest, and Iman Ahmednur from the Eritrean Ethiopian COVID-19 Solidarity Fund. And moderating today's panel is CCMW's National Executive Director, our very own Nuzhat Jaffrey. And without further ado, I will hand over the reins to Nuzhat.
Thank you, Fatima, and welcome everyone to this really important panel. I was just saying before we began that not too many people have actually had public discussions about this topic, even though we've read a lot about it in the media and we've seen it. But this is an opportunity for us to talk about this important topic. And really what we hope to do is hear from each of the panelists about what the problems and the issues were and how, what their perspectives on this issue are. But then we want to collectively prevent the same thing from happening next time, God forbid, and any measures that we can take to counter this sort of racism that manifested itself during this particular pandemic. So we know what the issues are. We know that racialized communities were disproportionately affected by COVID-19 because guess what? They are the larger segment of the essential workers. More of them end up taking public transit because of their limited economic means. Many of them did not have the luxury of being able to work from home, and because of other social determinants of health, whether it's housing or access to healthcare or social services, their experiences of infection were much higher. But then at the same time, they were blamed for the spread of the virus. And I'm really glad that Avi is here with us today because of the stigmatization of East Asians in all across the country. In fact, Vancouver was the capital of North America when it came to attacks on Asian individuals because of COVID-19. They were, harassed and physically attacked and so on. So we know what's happened in our communities. We know that racism, unfortunately, is alive and well in Canada, as we've observed in the recent killings of Muslims and ongoing attacks, and the surfacing of Indigenous children's graves over and over again. It's been a very difficult month for racialized communities across the country. So we want to tackle this important topic, and we've got a great panel today. And we invited them because of the work that they do in their own communities, local communities, whether it's in their constituency or whether it's with the populations that they serve. So welcome, Avi, Arif, Doly, and Iman. I'm going to start with asking each of our panelists to tell us about or speak about this topic from their own perspective. How do they see this topic? So we'll start with Avi.
First of all, thank you very much for the invitation. It's really an honor to be here with you today. I also want to acknowledge the traditional territory upon which I'm speaking from. It's the same territory, I think that was mentioned by Fatima. And I really want to reinforce also our commitment to work with the Indigenous people towards reconciliation and social justice for all. I also of course, want to also reaffirm my support for the Muslim community in our collective fight against Islamophobia, and expressing my deep sorrow for the loss of your community, in light of the recent murders of the four Muslim Canadians in London. So speaking today as a Chinese Canadian, I do want to share some of our experiences that our communities has faced over the last year and a half as a result of the rising anti-Asian racism in Canada, the stigmatization of our community. But I also want to remind people there's a very long history of anti-Asian racism in Canada, including, of course, the 62 years of legislative racism in the form of Chinese head tax and Exclusion Act, the denial of citizenship rights and the right to vote until 1947. And many of the things that we're seeing today have historical roots, right? For instance, the Royal Commission of 1885 called on Chinese immigration, called Chinatown hotbeds of diseases, right? And after Chinese were brought here to build the railroad, Chinese were considered unsanitary and were, they're treated as foreigners, which in turn became the basis for the legislated exclusion. So all of which give rise to these stereotypes of yellow peril, perpetual foreigner that continue to haunt our communities today and underpin the surge of anti-Asian racism as soon as the first case of coronavirus arrived in Canada. So in fact, since January 2020, before Canada or the World Health Organization even declared the pandemic, Chinese Canadians and many others who look Chinese were already experiencing verbal, physical attacks, both in persons and also through social media. People were being targeted. Some people received death threats, hate mails by advocates, including myself, and some business owners received those hate mails as well. And with funding from Canadian Heritage, over the last year or so, we've been working with the Chinese Canadian National Council for Social Justice and CCNCTO, among others, to combat the rising disinformation against Chinese. So one of the things we did was create this website called covidracism.ca, and we encourage individuals to report their experiences of racism. So between February 2020 and March 2021, 1,150 incidents were reported to this website. And so about 10% of those who reported were involving physical assault. Another 10% involved people being spat at, coughed at. 60% of those who reported being subject to racist attacks were women. As well, people under the age of 19, seniors, people who do not speak English as their first language are also more likely to be victims of racist incidents. I think there's no surprise, right? The racists are cowards and they perceive these individuals as weak, and therefore they are more likely to target them. And as Nusat mentioned, Canada is now reported to have more anti-Asian racism reports per capita than the United States. And Vancouver is now the top, incidents among North America. Their increase was about 700% in the span of 1 year in terms of hate crimes against Asian Canadians. And, this is no surprise, we went through the same thing during the SARS crisis. So we started, back in January, we had a press conference. We warned everyone against the rise of anti-Asian racism. But I have to say, even for myself, even though I could see it coming, I still did not expect this level of hate, this level of racism targeting our community. So if you ask me, could it have been avoided? I don't know. I don't think so. I mean, in a way, we live in a country where racism exists, including anti-Asian racism. I think the real question is, we knew it was going to happen, but why is it that many of our political leaders are not really responding to it or we don't see the governments putting in appropriate measures to dampen some of these incidents. So, maybe what the government should have done, as we have called on them to do, is to put out more public service announcement, not just about washing your hands, keeping distance, but also public service announcement about racism as a form of virus, right? But we never saw any such PSA, right? And apart from the Prime Minister did make some acknowledgement of anti-Asian racism during some of the media conferences, there really isn't any concrete measure at all levels of government. But of course, we have seen some politicians like Derek Sloan, the former Conservative MP, in fact, taking advantage of anti-Asian racism, capitalizing it by calling out Theresa Tam, Canada's chief public health officer, for working for China and questioning her loyalty to Canada. So the burden falls on community groups like ourselves, the clinic, CSC and CSJ, to combat the rise of racism. And we really want to see more support from the government. We did receive some support from Canadian Heritage. CCNCSJ also received some support for this from the City of Toronto, but I think more needs to be done. The federal government has announced $11 million for CRF to engage in anti-racism work. Some of that will go to supporting some kind of a national coalition on anti-Asian racism, but we don't know what this coalition will look like, what they will do. So, I think more discussion needs to take place as well.
Great. Thank you. That's what we're here to do. Have more discussion. Thank you, Avi. That was a great start. Arif, you're the next speaker on our list.
Sure. Thank you very much, Nuzhat, and salam alaikum, everyone, and thank you for having me here. It's always a pleasure to be with CCMW, and thank you for your long-standing advocacy on issues that relate to the Muslim community and much beyond it. I appreciate that. I also wanted to acknowledge the territory that I'm on, and Fatima did a very admirable job with her land acknowledgement. I'm also speaking to you from Toronto on the same territory that she had mentioned. So thank you for that. Je parle français aussi, donc si vous avez des questions ou vous voulez poser des questions en français, n'hésitez pas à poser-le et je vais essayer de vous répondre dans la langue de Molière. So, Nuzhat, you had asked us to sort of like conceptualize and sort of lay out a few things right at the outset, and I'm going to pick up on a few things that Avi had mentioned. It's always a pleasure to be on a panel with Avi and Iman and Doly. It's nice to meet you. It's a pleasure to be with all of you here addressing this important issue. I think what's important, just picking up on some of the themes that Avi had raised, is that there's definitely a component of sort of trying to understand how we got here and why we've gotten here. And what strikes me is that people constantly say to people like myself or Doly that it's not just about rhetoric, it's about implementing change, it's about legislation, it's about policy. And it's true, right? These shouldn't be in silos. But I think some of the rhetoric is important, particularly if you go back to the outset of what we've seen over the past 15 months, where people started to opine quite overtly about the source of COVID-19, where did it come from, which city, which country, and then just labeling it in ways that I think most of us don't appreciate or think is productive. So using terms like the Chinese or the China virus. And we know who I'm speaking of, but this leads somewhere, right? And I believe intellectually we need to be able to dissociate, and I believe this firmly as a lawyer, as a parliamentarian, that you should be able to criticize a government and not be accused of criticizing a people. But it seems the two have morphed, and they've morphed sometimes wittingly or unwittingly, or sometimes through carelessness. So I think that's one observation I would put out there at the outset. When you have, the leader of the largest and most powerful democracy, not the numerically largest, in terms of the former President Trump, leading the charge with that kind of labeling, it doesn't help, and it's not very productive. I think we then saw, if we turn our minds back, I remember being at events with members of the Liberal caucus at Chinese restaurants in Scarborough, and people wondering, should we go, should we not go, etc. What do people do? Are you going to catch something at a certain type of establishment? And we tried to act by example in demonstrating that if this virus is here, and it was definitely coming, it's not about any one particular community, and trying to show some solidarity. So I think that symbolic stuff is important. I'll say to you, it's also resonated for me personally as the representative of Parkdale High Park. I represent the largest Tibetan diaspora in North America. the largest in the world outside of India and Nepal. And there's always confusion between Tibetans and Han Chinese individuals, but the amount of virulent East Asian racism knew no borders in terms of ethnicity. So they faced it the same way that Vietnamese people, Filipinos, etc., faced it. And I see Avi nodding her head because she knows about this, because these are the clients that she serves. And it's troubling for me as a local representative, as well as a parliamentarian who works on justice issues with Minister Lametti. In terms of sort of the scapegoating, I think it was interesting because then it morphed from, and again, this is not news to anyone, but it morphed from, well, who caused it to now who's spreading it. And that's when you enter people that look like me, people that are darker than me, people that, as you accurately surmised, Nuzit, and we've got the statistics because Fatima mentioned them, that people who just don't have the money or the luxury to work at home, they don't have internet service, they don't have a computer, they've got to get on a bus, they've got to get on a streetcar, on a subway, they've got to go to their frontline work because one, Toronto or Canadians still need to eat food and have groceries on their shelves. So thank you to all those people that did that important work and continue to do it. But they had to do it because they had to be physically present on their place of work, at their place of work. And these essential workers, whether they're people in the gig economy or Uber drivers or people stocking grocery shelves or people cleaning up buildings, etc., invariably look like a lot of the faces that I see on my screen right now, right? They don't look, they're not Caucasian faces. They're not upper middle class individuals living in multi-story homes with, internet access on 3 levels of a house. Those are not those people. And those are the people that became, one, more likely to be affected by COVID and potentially more likely to spread it, given their sort of their station in life or in Canadian society. So it went from who caused it to who is now spreading it. So the scapegoating just furthered. And I think it's very, very problematic. And I think all levels of government, so I'm going to try not to be too partisan here, need to be a bit more clear and more pointed in terms of recognizing that reality and then addressing it. And I'll confess to you some frustration when even pockets of my community in Parkdale Park were designated as important priority areas, and yet still we didn't see the mobile clinics, the vaccination hotspots, sort of pop-up clinics being as readily available as they were in other sectors of Toronto or other sectors of the province or the nation. And I think we've all got to sort of introspect a little bit on that, on how we can improve things. I think in terms of sort of could it have been prevented, I feel like there's at least been some, I'm not sure, is my short answer. I think there's at least been some reflection and awareness at the highest levels, not manifested by all leaders, but at least awareness of the fact that national labels don't really help in terms of moving past where we are right now. And I think now, 15 months into this, we now talk about a Delta variant, right? I'm painfully aware that the Delta variant originated where my ancestors are from, South Asia. But unlike the Spanish influenza of 1918, we're not talking about, an Indian or a Pakistani variant. We're talking about a Delta variant. And I think getting to that kind of new vernacular helps. And I think we've made some modest progress there in terms of not stigmatizing nations or nation states or pockets of the globe, and just identifying things for what they are by a different name and working collaboratively to address them. So I take some comfort from steps in that direction. I think education has got to play a part in this, and I take Avi's words to note. I think what we've tried to do at the federal level, certainly what I've tried to do for 6 years, is ensure that we have got programs in place, like an anti-racism national plan that was defunct under the previous government and we resurrected, but then it's also funded. So we've increased funding to that to the tune of an additional $50 million in the last fall economic statement. But now also, as Avi mentioned, dedicated money, the Canadian Race Relations Foundation, headed by, I'm sure, a colleague of all of you, a fellow named Mohammed Hashim now, who does very good work. But I think we do need to speak out more clearly. And I take, what Avi said as fair comment, that it's one thing for the Prime Minister to say something at one of his daily press conferences when we see egregious anti-Asian racism, but it's another thing to manifest that in terms of policy. The policy piece is something I'm very committed to personally as a member of our government, but also generally as a parliamentarian. What I've been trying to do and reaching out to many of you in different forums is work on some of the hatred and stigmatization and stereotyping that is seeming to be fomented online. I'm sure we'll talk about that more as we get into this, but online hatred and online radicalization and online prejudice and bigotry is really, really pernicious right now. It's something that we need to address. And I hope you've seen the signal that we've demonstrated by tabling Bill C-36 to implement some response to the online hatred we are seeing with a reinstatement of Section 13 of the Canadian Human Rights Act, an entrenched definition of hatred for all actors in the system to work with, and also implementing a new peace bond. And I'd be more than happy to get into a discussion about what's going on specifically with respect to the Muslim community, because like many of you, I've been very affected by what happened with the Afzal family and what continues to happen, particularly to hijabi sisters in Edmonton right now as we speak. So those are really important issues, but I'll leave it there in terms of sort of opening comments, and we'll continue the discussion as we move through the panel. Thank you very much again for having me.
Thank you, Arif. That was really helpful, especially when you spoke about what's happening on the ground in your own writing. I'm now going to ask Doly for her perspective. Thank you, Doly.
Thank you so much, Nizat. Assalamu alaikum, everyone. Adab, good afternoon. It's an honor to be here amongst all of you. And obviously, thank you so much to the Canadian Council of Muslim Women for organizing this beautiful discussion and a very important conversation that needs to be had in order to make a lot of the policies that I feel like that we've kind of hinted towards. I'm the MPP for Scarborough Southwest, so I work really closely with my community in Scarborough Southwest, but also some of the ridings across Scarborough. I've found that there's a lot of need especially during COVID-19. So, I mean, I was looking at some of the questions and I was thinking about, it was sort of reflecting on the past year and a half and what was happening. And I'll start off by one of the first things that we noticed, which was anti-Asian racism, and AV and Arif both talked about this. And this was something that was, I think, very much influenced by politicians, but also in the communities. And I remember in the beginning of the pandemic, words matter so much. The way we identify something, the way we call something really sets the ground for how we're going to address it or how we're going to go about it in our families, in our friend circles, etc. And that was a huge component of how we sort of stepped towards the pandemic and eventually figuring out, we needed COVID testing centers, for example, and then obviously which communities were affected more. So when I think about stigmatization, and one of the first things I experienced in my area, which was having a really difficult time having sort of the balancing effect. So we had our community where a lot of the neighborhoods were really badly affected by COVID because they were essential workers, because there were people who do not have the ability to go on Zoom or to go and have online work from home. And they were traveling to, Etobicoke, Mississauga, etc., or just going out, taking the TTC to go to work. And work was also a huge, it wasn't just about, I can take some days off, I can try to balance it out from in person or work from home, etc. But it was that if I don't go to work today, I don't have food to feed my kids. If I don't go to work today, I may lose this job. And those are huge pieces that sometimes I think we as politicians or decision makers, and I have to say, I grew up understanding what poverty is, but right now I'm very privileged to be able to work from home at times, to be able to, pay for essential needs for my parents. But a lot of people in our communities, especially in areas like Scarborough, across the city, don't have that. And what happened was those areas were more affected, and they were seen as sort of the problem areas, where COVID is most. And therefore, you don't really go there. But they were the one that needed most amount of services. So it was a constant battle getting a lot of COVID-19 testing centers. And because we weren't getting enough testing done in those areas, we did not know what the rate of infection was. And eventually, when that fight sort of with a lot of organizations, a lot of political will, we did get enough testing done. But what that looked like was that, oh no, these communities are the problem. This is where COVID's coming from, therefore they are the problem. And that is a huge issue because then a lot of people become hesitant in going and getting tested, for example. So if they come across COVID at work and they don't want to get tested because that means they may not have paid sick days, they may have to go and get tested without being able to get paid sick days, or they're now feeling that stigma across their communities or in their building So then if they're taking the elevator, they're having to, deal with all of that stigma. So all of those pieces were I think missing from a lot of the decision-making process. And then obviously, we talked a little bit about prevention. Some of the other speakers talked about it. I don't know whether we could have prevented, but I know we could have prevented the spread in the way it took place in some of our neighborhoods. And I know we could have protected some people in areas where, they're more racialized, marginalized communities. And I know we could have prevented a lot of our elders who were much more vulnerable. And those were based on what kind of policies were put in place much before COVID. And the same goes for vaccination. I mean, it's been last 6 months of constant fighting to get local clinics. Why are we, when we know the rate is high in some communities, why are we giving vaccines based on population? Let's do it where the fire is at, right? Let's make sure that we put out the fire, we help those communities, stop the spread, and that's how we make sure that we beat COVID. Fatima Said, a journalist, a reporter, a racialized woman, also wrote a beautiful article talking about how if you do not beat COVID in Peel, you are not going to beat COVID. And it was so well put, because what was happening in Peel and in areas like Scarborough, we were not getting any clinics, even though they were the people who needed it most. And I think it comes from years of marginalization, years of neglect in areas where the need's high, but they have not been able to have the power to fight back. So people who organize, who are the loudest or who are affluent, get much more attention, and people who have to go out to work, who don't have the time to fight back, are the one who get left behind. So somehow this becomes a circle. And obviously I would love to talk about, some of the intersection of these issues, and how people who are, women who are South Asian or Black, for example, were affected, and the fact that those areas could have been protected in a better way as well. So I'll stop here, because I feel like we're going to have a beautiful conversation and talk about a lot of different issues and how to address them.
Thank you, Doly. Well put. So I'm now going to ask Iman Ahmednur to talk to us, because she has a slightly different perspective. It was more solution-oriented. So Iman, over to you. Thank you.
Thank you so much, Nisa, and thank you so much for everyone for inviting me onto this panel. I'm really excited to be here and to be among our great panelists. So like Nisa mentioned, I have a bit of a different perspective. I come from the Eritrean Ethiopian COVID-19 Solidarity Fund. And so what it was, it's an initiative that was made up of 5 Eritrean and Ethiopian young women from the GTA. And so at the beginning of the pandemic last year, we recognized that many folks in our communities were being left out from receiving a lot of the emergency benefits that the government were offering during the pandemic. And a lot of these folks were not meeting the requirements, so they weren't able to access like CERB and CESB. And so we decided to start a solidarity fundraiser to support Eritreans and Ethiopians in the GTA that were experiencing difficulty meeting their basic needs due to the pandemic. And these urgent needs included things like rent, medicine, food and water, and mental and physical care. And so our initial goal was to raise and distribute $5,000, but from May to July of 2020, we were actually able to raise $57,000, and that was distributed to 148 applicants. Wow. So I wanted to just speak a little bit about the core values that backed our work. So one was solidarity, not charity. And so we really believe that this initiative, we started this initiative not out of pity or charity, but because we believe that we are stronger when we are standing together. 2, collective and individual autonomy. So we believe that the individuals receiving the money from the fund knew best about how to meet their own immediate needs. 3, non-judgmental. So we're not trying to judge our community members on their deservingness for funds or their experiences. 5, transparency. We were accountable to our community members, and we reported on where the funds we raised went. And lastly, accessibility. So we worked to reduce barriers to accessing the fund. So we did this through offering the application in multiple languages, building community relationships, and having a phone line for those who couldn't access our applications or resources online. And so our values were really underpinned by an understanding that the current capitalist system produces the inequality that we're trying to organize around. And this pandemic demonstrated that our communities couldn't really rely on the institutions to meet our needs, and rather we collectively could meet our own needs. And so we completed dispersing the funds late last year, and we're now working on reflecting on our experiences and writing a report that will summarize our learnings, and hopefully will be coming out soon. But I won't go into much more detail, but if you'd like to learn more about our work, you can visit our website and our Instagram page. And I'm going to drop links in the chat that you guys can access. But I want to speak about how my experience in this initiative connects to the stigma that has come up about in racialized communities due to COVID-19. And so my experience with this initiative and the pandemic as a whole has highlighted various widespread pre-existing inequalities that marginalized communities face in the GTA. And as Fatima and Nisa mentioned, these communities are constantly facing stigmatization. And personally, since the start of the pandemic, I have seen a narrative that blames racialized communities for the spread of COVID-19, because statistics show that there are higher COVID infection and mortality rates in these communities. But these statistics don't necessarily speak to the fact that these marginalized communities have higher rates of essential workers, higher rates of people that rely on public transportation, and higher rates of folks that have unpaid sick leave. And then as a result, higher COVID exists in these communities. So the conversation around the spread of COVID-19 tends to center around how folks in these communities disregard rules and regulations that are put in place by the city. But through my experience, and I'm sure a lot of you can agree with me, this narrative doesn't really tell the whole story. So I really believe that we are in a time of crisis, and that this crisis has exacerbated the already difficult conditions folks in these communities are facing. And so I don't know if this stigma could really be prevented, but I really think that giving folks from these communities the opportunity to be heard could have really helped. Like centering their voices in conversations could have provided counter narrative, and institutions should provide the space and platform for them to do so. This pandemic has not only highlighted the inequities marginalized communities are facing in the GTA, but I also think it has shown the strength and resiliency of these communities. There are so many qualified community leaders that are on the ground that could speak to the effects of the pandemic in their communities. And it's not that they're not speaking about it, but it's that their voices are not really being championed by those who have access to and influence on the greater public and common discourse. I will leave it at that for now. Thank you so much.
Thank you, Iman. So I want to take a moment and express my pride. Iman is also on the CCMW team. So thank you, Iman. So that was a really good introduction to the topic. I know we have a series of questions that we want each of you to address, and then there will be time for our audience to also ask questions that will come later on. And you can pose your questions either in the chat box or use the raised hand feature when we come to that portion of the program. So I'm now going to ask our panelists to speak a little bit about the strategies that you are using currently to address the problem. So what are you doing right now to address the problem? Avi, let's go back to you.
Sure. So what we have been doing over the last year or so is that, we've been trying to push the governments of all levels to specifically address and name anti-Asian racism in this strategy. So for instance, at the federal level, we've been working quite closely with the Anti-Racism Secretariat. So, for instance, we recently helped the ARS develop a working definition of anti-Asian racism that they're going to use for all the departments within the federal level. And of course, we will continue to push the federal government to name anti-Asian racism in the broader anti-racism strategy, and of course, come up with more specific measures to tackle this issue. At the provincial level, we actually worked with the Liberal MPP Michael Coteau to put forward a private member's bill to amend the Ontario Anti-Racism Act to specifically name anti-Asian racism in the legislation. And we've done a lot of media interviews, events, educational workshops. It's like I lost track of how many of those I did over the last year. I think I personally did close to 200 media interviews last year and done almost 100 presentations on anti-Asian racism since January. But I think it's also very important for me to address the systemic issue, because I think oftentimes we just kind of say, oh, anti-Asian racism, we think of those like attacks, right? The attacks on the street or the online hate. which is very important. But I hope we don't forget about the systemic issues, such as the high percentage of people living in poverty among Asian Canadians. That's still true today. Like sort of like for Chinese Canadians, the poverty rate is 23.4%, which is double that of the white population. We still have discrimination in the labor market. So if you have an Asian name, like South Asian, a Chinese name, you're at least 30% less likely to get a job interview. And recently, the CCPA, the Center for Policy Alternative, actually released a report called Color-Coded Retirement. And it shows that Chinese seniors have the lowest average income and the highest poverty rate among all racialized groups, including Indigenous seniors. So these are really serious systemic issues that we haven't even had the chance to talk about, right? So the lack of representation in government, in parliament, and among judiciary, at the city level, like all of those issues affect us, and which is the reason why when anti-Asian racism happen, when they are like happening on the street, we're not getting the response from our political leaders because they're not even reflective of who we are. So I think that in the long run, I do want to see more opportunities to address issues like employment equity, sort of, collection of disaggregated race-based data. Those measures are just as important if we want to address the root cause.
Thank you very much. Arif, to you, the question was what kind of strategies are you using currently to address the problem?
Certainly. And I feel like there's a bit of a sort of a AV goes and I respond and we sort of agree on some things. And just to pick up on a bit of it, on disaggregated data, 1,000% agreement, right? We need to know that it's not just racialized people, it's not just Black Canadians, it's Somali Canadians that are affected by certain components, et cetera. So disaggregation is something I've been talking about for 6 years. It's something we committed over $180 million to in the last budget. So that's important. I think it's also important that if we step back a bit, and I'm going to jump around here a little bit, Nuzet, but I think we did do something quite well, which was ensuring that when vaccines were coming, that we avoided a completely unmitigated disaster on remote Indigenous communities. And we really targeted a vaccination push in very remote areas where people just wouldn't have access to an ICU that you would have in downtown Toronto. That went well, but I think we'd probably all agree that we need to have the same sort of acute analysis and targeting of other disproportionately impacted communities who are disproportionately impacted by COVID. So I'm building off of what Doly and Avi and others have said, that it is racialized people of various backgrounds, various people of color who are working in those frontline areas. We need that same laser-like approach, and we didn't have that, and we should have. In terms of sort of, you asked generally, what are some strategies we're using to currently address the problem? I mean, there are some sort of motherhood statements, but I think they're important because it's not just what I started out by saying, where there's some very choice and quite offensive rhetoric that's used by some elected leaders. It's also the role of media in perpetuating that information and spreading it, sometimes very irresponsibly. So I think there's a role for media to play here in terms of analyzing themselves, how they're contributing to perpetuating stigmatization, stereotype, and prejudice, particularly amongst COVID-affected communities. I think there's a role to play for the education system. I'm conscious of today, I believe, I think a news release came into my email inbox where the provincial government is committing money towards the Muslim community in the wake of the London attack on the Afzal family. That's important. That's a step in the right direction, but we need a ton more of that at every level. And it's difficult for us to adjust federally because we don't reach down and control curriculum at the TDSB, right? We can set up best practices at this level and try and provide funding, but ultimately the implementation is for levels of government that are not my own. But I think that's important. One thing that I remain very seized with, I mentioned to you at the outset, was that the work that I've been doing on online hate and how hatred and stigma and stereotype is perpetuated online. We are trying to work on that. But I do feel that the work is nowhere near done in terms of the people that then interpret and apply our laws. And by that, I mean law enforcement actors. We do need much more robust responses from local police units, from federal entities like the RCMP, CSIS, CBSA, et cetera, from Crown Counsel, even from judges. We've made some steps in the right direction with things like judicial training there's a bill, you don't need to know the minutia, but it was Bill C3 that talked about gender sensitivity and sexual assault understanding of judges. But we amended that bill to say they also have to look at social context, which includes systemic racism and systemic discrimination, building on the heels of all of the awareness post George Floyd, post what we've seen with the Indigenous community in this country, the Mi'kmaq fishermen's dispute out east, etc. Those are steps in the right direction. Those are the kinds of things I'm working on, but a lot more work needs to be done, I think, in those areas. And I'll end with one last piece, because Avi touched on this at the start, but I think it really deserves going back to, and I think Doly sort of flagged it a little bit as well. But it's this idea about people coming forward to those who they can trust. So I don't think it's so much, or maybe it was Iman was making me think about this, because I believe very much in what you're doing, Iman, and I congratulate you. I salute you. If I knew how to say congratulations in Amharic, I would say it, but I don't know how to say that. But what I do feel is that I don't think it should be either or, that either Iman's able to do it or government representatives like myself or Doly are able to do it. I think ideally we could have government entities empowering civil society and local grassroots organizations to do it on their own behalves, and providing that funding, that mentorship, whatever is required to empower those groups. And the tangible example I'll give you, Nuzet, is that I still think we need to do a better job of ensuring that when it comes to reporting stigma and stereotype and hatred and prejudice, I know, because I've heard about this from hundreds of people I've consulted, that they say it's much easier for a Muslim woman to go to another Muslim woman and raise her hand rather than to a white police officer. It's much easier for a Jewish person to go to a rabbi. It's much easier for an Indigenous person to go to their local chief, et cetera, et cetera. We know this to be true. The problem is that we don't value that information. We don't legitimate it in the same way because it didn't come from a government institution, a government ratified entity. That kind of bias and perception has got to end. We have to empower local community organizations that are entrusted by their own communities to gather information that is credible and rigorous, and then use it to inform public policy. So I'll leave it at that. Thank you so much.
Thank you. Thank you very much. Very helpful. Doly, how about yourself? What are the strategies that you're currently using?
Thanks, Najat. There's quite a few things that we found, I think, were very, very helpful, very necessary throughout the pandemic. And I think one of the first steps were basically, I mean, there are a lot of steps that did not succeed, including, paid sick days, things that we wanted for our communities. And that was a big one for essential workers, many of whom are racialized folks. And but there's, I think, local community grassroots level organizing that really worked. And I also want to congratulate Iman and the work that you have done. And also, I think, shout out to every community leader who's done fantastic work and really filled the gap that I think were there in terms of the government policies, which were so important, because I've seen the lines at the food banks, and I've seen the color of the skin of those who lined up, and it really showed the discrepancy or really the discrimination, that's been there for many, many years in terms of housing support, in terms of support that people need, and the type of jobs that people have. And when we talk about, and I think Avi talked about this as well, we talked about the issues that we're facing right now, but the historical marginalization of our communities are what caused us to be where we are today. And I'll start off with long-term care. This was something that we worked really heavily on throughout the pandemic. And one of the long-term care homes that we helped, and we worked with a lot of the family members, were tender care. Tender care is a little bit outside of my riding, but we had few family members who lived in the riding, so they reached out to us. And then we ended up connecting with people across the city who had loved ones in tender care. Now, those of you who know tender care, it's mainly Asian or East Asian community members who live there, elders who live there. A lot of them don't speak English. A lot of them don't feel comfortable, talking to the workers who were there. We had one example where they needed to have something written in English just so they could have sort of, here's what I need every few hours. It was just heartbreaking seeing the way that people who are racialized, and again, I think Avi talked about the rate of elders who retire and how much income they have when they retire. it was heartbreaking just seeing what's happening to them and how many we lost in tender care. I mean, it went from 3 people infected to 30, 40, 50, and then 75, 85. And it was unbelievable and unacceptable. We had, and before I go into some of the work that we did, I just want to say we had a town hall where I invited the grandson to come and talk about what was happening and how they're trying to address it. And the day I talked to him, 2 days before the town hall, he told me about how he made this sign that says, please give me hot water, because she needed hot water and she liked drinking hot water. And it was also hard for her throat and her stomach. And we're really glad that he was finally able to do that for her, for his grandma. And 2 days later, when he joined the town hall, at that town hall, he let us know that she passed away earlier that morning. It was, and the fact that she died out of dehydration and neglect in a home where she's supposed to be cared for. The reason we leave our elders in these homes is because they need extra care. They're not people who are able to walk around. They're fragile and they need help. And I think that's the type of systemic problem that has caused for those who are vulnerable to be where they are. And during COVID, they were kind of put into this jail cell and shut out in a way without any support or protection. And families were kind of, put across with a barrier. And I honestly, I was pretty vocal about it, and I've openly talked about it. The fact that there are other homes that I advocated for, and I was able to get support for them easier than tender care. We were able to get Red Cross into tender care and other support come in much faster for other homes than tender care. And I truly believe that because of who they were in those homes, it took longer. Yes. And that should not be the case. And that's what's happening. And when we talk about structural problem in our communities, and that's for our elders. When we look at the mental health support for our kids or what's happening in our schools, a lot of the schools that we have in our communities that need more help, no more investment, that where you cannot open the window, for example, where you don't have air conditioning, are the ones in these communities. And who go there? It's kids who are Asian, South Asian, kids who are Black. And I agree with you, we have to make sure that we have disaggregated data for specific population as well. But it's also a stronger, I think, argument when we look at it from a larger picture. And I want to add a little caveat here, is a lot of people are very afraid of like census or data collection for good reason, by the way, which is why sometimes they don't fill out the information. So we have to do better in terms of creating awareness of why this is necessary, how it is used, and protecting their data. We know recently in the past 2-3 years, our health data were not protected as well. And we as a provincial government could have done much better in terms of that and creating that space for people who are racialized to know that they're feeling their information is protected. When we talk about we talked about the clinics, for example, we talked about Islamophobia here. I mean, the fact that we have masjids in our communities that still get broken glasses, broken windows, and they're still feeling like they do not have a space to come and talk about it after what's happened in the last 3 big incidences. And I say 3 big because I'm talking about Quebec and the caretaker in Toronto, as well as in London recently. I think there are continuous issues that have gone through for many, many years, where we could have done a lot more in terms of protecting them and creating that safe space. So when we talk about some of the steps that we're taking, I think the grassroots organizing helped a lot. So getting tender care desk support, for example, or getting local clinics where we actually talked about, here is what we need to do, and here is how many people who have been vaccinated. One of the things my office has been very successful at is working with our local health networks. So after there's so many meetings or so many calls to the government, we just kind of went straight to the health network and said, you know what? We know you want to vaccinate people in our communities. Let me tell you which communities need it more. And then we kind of sat at the table, and they were very welcoming, and they loved the information that we had to give them. And also making some of the, so, the work that Iman's doing, for example, she will have access to better information of what that community is going through. So making sure that people like her, people who are in leadership positions, people who are working in the community, who belong to the community, are at the table as well. So we have amazing organizations like Access Alliance or Soro who know exactly what's going on in our buildings, who know exactly what's going on in Oak Ridge community, for example. So getting those people at the table and making sure that our health networks, our governments are aware, and then providing that support. So that we found really helpful. And I think we had a lot of small wins, which really added up and protected and supported the local communities that we needed, especially with racialized women, especially with children who are dealing with online classes or mental health support, or elders who are dealing with long-term care or needed things like vaccines at home or homebound. So there's a lot of kind of different ways of going about and supporting them that were very successful.
Thank you. So it sounds like a lot of direct intervention or direct contact with people and helping them that way. Iman, you already told us how you help the individuals. Are there other strategies that your organization is currently engaged in?
Yeah, definitely. So along with raising the funds and getting cash into folks' hands, we also wanted to encourage greater political awareness and education, specifically in regards to community responses in times of crisis and how we can support one another during these times. But this initiative also gave us an opportunity to engage with community members and gain an understanding of the conditions they were experiencing during the pandemic. And so what we did was we released some quick fact sheets that summarize the data we have collected so far. And this highlighted who was excluded from government emergency benefits. And some of these groups were newcomers, international students, folks who were laid off prior to COVID, and so on. And additionally, we've also tried to speak with some of our recipients of the fund, as well as other Black mutual aid initiatives that were also created in response to the pandemic. And so what we're going to do is we're going to take our learnings and include these in our upcoming report. And so through this, we're trying to center the voices of those that are being directly affected by these stigmas and inequities, and try to provide a counter narrative to these stigmas that exist, while also using our platform to spread awareness about other mutual aid and community response initiatives that are available in the GTA.
Great, thank you. Wow, that's a lot. That's a lot that you're currently doing, and we're learning from all of you about what else can be done. So I hope everyone on this call is able to take something back from all of you. So maybe I won't have you speak in turn. You could, any one of you, the four panelists, could raise your hand to tackle this one first. So how do we prevent this from happening again? It happened. It has had terrible consequences for our communities. How do we prevent it from happening again? Who wants to tackle that first? Iman, go ahead.
Yeah, I just want to briefly say, this has already been mentioned, but like these stigmas are rooted in racism, and racism is a systemic issue. So we need solutions that address these systems that perpetuate these inequities. And something that has been mentioned, I believe it was by Avi, language is very important. The language we use affects the way racialized communities are perceived. And so we need to really center marginalized and racialized voices in these conversations, and to look to these communities to inform us on what steps need to be taken to create sustainable solutions and to inform public policy. I think that is a really clear and obvious step that can be taken moving forward.
Great, thank you. So Avi was next, and then Doly. Avi?
So it is a very interesting discussion. I hear different people focusing on the different aspects of the COVID-related issues. So one of them is around the anti-racism piece of it, sort of talking about education and all that kind of stuff. And another piece is about the healthcare part of it, and the third piece is about the support. So I think all of these things need to be worked on together. So on the anti-racism piece, I totally agree with everything that has been said. And I think Arif mentioned Bill C-36. So I think that's really is a good start. But I'm hoping that over the course of summer, the minister will continue to consult with organizations like CCMW, like NCSJ, to figure out how to improve on it, to make it even stronger, right? On the healthcare piece, and Doly mentioned around the long-term care. So if you look at the long-term care facilities in Yihong, which is like a ethno-racial, long-term care for Chinese and other racialized seniors, provide culturally, linguistically appropriate services. They have the lowest rate of infection among all long-term care. Partly, I think it's because they are not privately run, but also because they are really there to support the people, within that, in the community-based model that really support the people based on their needs. And I think that there should be more homes like that, right, for different racialized communities, right? And the provincial government really should be supporting those kind of ethno-racial specific homes, provide them more funding and so on. And the last piece around the efficacy, I think we really need more targeted, what we call targeted universalism. So we want everyone to access the same care or the same, outcome. But for some communities, because of their disparities, the pre-existing inequities, we need targeted measures to make sure they have the equal access to that equitable outcome. So be it in the form of access to EI, CRB, CCB, or whether it's about job creations, like all of those things, the government really need to have a race equity lens and looking at how to support these communities where they are, right? Because we are not in the same situation. And I think really COVID highlights that. Some people say we're not in the same boat, or we're something, whatever those metaphor, like, we're in the same boat but not the same tide or whatever, like, so it's just the idea that it's not the same because, people are in different situations. We need different measures, although we want to have the same universal goal.
Thank you. Great suggestions. Doly, how about yourself? What can we do to
just
prevent this?
echo the words that Iman and Ivy already said. I think I would add a few of the policy pieces that I've personally been working on, and we as me being in official opposition, but I know a lot of the community members are calling on as well. And I see Nasima Akhtar on here as well from BCS, who's been doing fantastic work and taking leadership in our community and helping a lot of seniors, a lot of youth. One of the big pieces I want to highlight is mental health, especially youth mental health. As another pandemic, many folks are calling is on the way, and we're going to have to be very prepared for that. And I think both the provincial and federal government will be, will need to be ready to take that on, because that's just the impact of being at home and what I think we have really seen with a lot of people who are stuck at home and what they've gone through, that this is going to be a big piece. I also know that domestic violence has increased in a lot of the women that I've talked to locally who do not have a safe space for them to go to anymore, or a safe, and I think in the beginning, someone was mentioning how maybe Arif mentioned, there are people who will, be able to share what's going on in a structural context with Nujat, for example, or Iman, but not with me or especially with their white counterpart or a social worker who does not belong to that community. And that is such an important piece when we're dealing with domestic violence, when we're dealing with mental health issues, especially for the Muslim community, for the South Asian or many racialized communities, or including the indigenous community as well. And right now we're missing that piece. And we need to be investing in that, and we're investing in a way where we take into the structural and the social context. I've had many people talk about how they don't even have words in our language to address what mental health or depression really means. we don't have words to understand what depression is. And sometimes the words we use are just means plain crazy. And that is stigmatization on its own, and we have to do a lot more on that. And then I'll end with the piece that I think is going to be really important, which is provincially having an anti-racism directorate. We had an anti-racism directorate. Unfortunately, the government got rid of it. And I know CCMW and many others are calling for this. And we really need to push that front and make sure that it comes back and have investments so that the directorate is able to do work where we do not have another Fayaz, a 9-year-old kid without his parents and his family. We do not face issues where any woman on the street is dealing with violence, or just because of who she is or what background they're from, and that is going to be a big piece that I think maybe we need to rethink how do we do it as well, because the way it did not work either. There were pieces missing from that. So understanding it from a religious, ethnic background, which is much more intersectional than nuanced than it was before.
Thank you. So I will go to Arif and then back to Avi, and then I have the next question. Arif?
Sure, thank you, Nuzhat. It's you started out by saying, how do we prevent it from happening again? And I guess the current response is that there is going to be some other future health event. I think that's inevitable. And what we need to do is try and respond to try and avoid this kind of stigmatization and stereotyping and prejudice that we've seen when that next health event happens, because there will be some future health event. And what I'm always taken by is a phrase that we used a lot at the federal level, but I'm sure people are aware of it with respect to the people with disability community, where they would say, nothing about us without us. And I think we have to take that sort of mantra of sort of listening to communities and apply it to what we're talking about here. Right? So no matter what solutions are dreamed up at the municipal, provincial, or federal level, it is community-led and community-driven by people like Iman, who are coming up with great ideas on the ground for Ethiopians and Eritreans, for example. So that's sort of a general point. I know what Doly just said, and also what she said a bit earlier, and I was sort of grinning when she was talking about sort of, as she said, she just went directly to the local public health units. And I know why she did that, and I salute her for doing it. And I'll confess that there have been times when we've sort of gone, having not had a great response by certain levels of government, we've gone to other levels of government and sort of leapfrogged here and there. But I think she's right, and I think we'd all agree that when it comes to things as basic as fighting prejudice and bigotry and racism, this shouldn't be sort of partisan or ideological. Like, every one of us has something to be gained by addressing this pernicious issue. And it shouldn't be sort of contingent upon how much you prioritize based on which political stripe is in power. That's got to be the wrong way. And I take some comfort, as small as it is, from the fact that in the wake of the London attack, we have seen people of Her Majesty's official opposition in Ottawa raising their hands and apologizing for positions they've taken as recently as 2017 or even in 2015 with the Barbaric Cultural Practices Act. So the light bulb can go off. I just think it needs to go off more regularly across party lines. I think a couple of tangible things at the federal level that we still need to work on to help with the prevention piece on a macro scale with respect to hatred and prejudice is dealing in part with what Avi was referring to, which is that we've tabled this legislation C-36 that is part of an answer to what's going on online. But the big answer is about how do you regulate where this stuff really festers, which is Facebook, Twitter, Instagram, etc. And that's regulation of social media entities. That's something that the Minister of Heritage has been working on and continues to work on. But that work needs to be expedited. I think there's also a piece about ensuring that if we look at the reality of the violence that's being perpetuated in this country and where it's being perpetuated, and based on stigma and the stereotype we've been talking about, it is too often that racialized people are on the receiving end on the backs of things like white supremacist groups. So what do we do with those white supremacist groups? How do we categorize them? Do we list them as terrorist entities, etc.? I think that's part of this equation. It needs to be fed into it. On the piece that Doly talked about in most detail about things like the institutions, I think that's critical, particularly the healthcare institutions. And what we've done is made a federal commitment to imposing national healthcare standards, to creating them. But it gets difficult, right? Because it doesn't matter whether it's the current provincial government in Ontario, the previous provincial government in Ontario. No one likes taking hard rules and directives from Ottawa. It doesn't matter your political stripe. But I think we need to be firm in some regards, which is that not only should there be standards, but we should say, here is the dollars that go towards long-term care institutions. And if you don't meet those standards, you don't get these dollars. Like, it's got to be that linear. And we do this with the Canada Health Act. And if you violate the principles of the Canada Health Act, you don't get your OHIP program funded in a province like Ontario. There's no reason why we can't apply it to the long-term care setting. And then the last piece I would say is that two more pieces. Cultural competency was, people were talking about it in the chat. I think that's got to apply across the board in all of these sectors: education, media, journalism, law enforcement, lawyers, prosecutors, etc. But we can also do better by increasing the representation, right? And we've tried to do this as a federal government in terms of all of our appointments. The ones I'm most familiar with are things like what we're doing with the bench. There's certainly a long way to go in terms of having a judiciary that reflects more of the community and the litigants that appear before it. But I think that when you get steps like what we've just taken in the last 7 or 10 days with the appointment of Mahmoud Jamal, a person of East African background like mine, raised as a Muslim, now a practicing Baha'i, when you put a person of color on the Supreme Court of Canada, I think that's good and that's important because it represents a change in sort of the approach, a change in sort of how we're valuing personal experience and lived experience. But that's got to apply across the board in so many different sectors. So there's lots more work to be done on that front. So I'll leave it at that. Thank you so much.
Well, thank you. So it's almost like, you know, we're sort of getting out of breath because there's so much work that's being done that could be done. So hopefully there'll be opportunities for all of the work to get done. But one of the things that I've heard from, you know, I think Arif, you mentioned this. So just, you know, in the last 18 months, the change in language is really, really important. So, you know, if God forbid another pandemic, you know, is beginning and it's originating in a certain part of the world, right away, it should be named something other than, you know, the country of origin or its geographic location. That's something that's very easy to do. And I guess that's not just here in Canada, but, you know, the World Health Organization needs to behave that way so that, you know, at the global level, it starts off with something that is not racially based, but is, you know, factual and cannot be attributed to any peoples. So that's great. I mean, those are some really important strategies and ways of preventing it from happening again. But this is more asking for, you know, your perspective on what we can do. So we're an active proponent of anti-oppression and anti-racism advocacy and education. What else can we be doing to support the ongoing efforts of our stakeholders to address the issue? So we mentioned that we have the Digital Anti-Racism Education Project funded by the federal government. It's all focused on education and highlighting the experiences of racialized women and women who are victims of Islamophobic attacks. But you know, everyone's talked about education as one piece. But what else could CCMW be doing to address the issue? So I'll go back to the order of speakers. Maybe Avi, you can go first. Sorry.
Sure. That's okay. I actually, when you ask this question, the question applies to all of us. Like, it's not like, what should CCMWs do? Like, what should we all do, right? And of course, like, part of me is thinking, like, the fight against racism, oppression should not fall only on the shoulders who are experiencing racism and hate. It's like, we're the ones who are always saying, oh, what should we do more? It's like, why is it that we always have to do more, right? But at the same time, like, there's so much more we can do. And I think really about what can we do more strategically to support each other? I think maybe that really is the question, because Nuzat, like, myself, like you and I, like always at the same conferences, kind of, working with each other, supporting each other. So what can we do to support more strategically? And, so I don't know I have the answer to that. But certainly I find that with this pandemic, which is different from before, is that there are so many other people who I've never seen involved in this kind of discussion. They are involved right now. Like, so many people, so many more people want to talk about racism, and so many more groups want to talk to each other about the experience that they face. So I think certainly more of, this kind of dialogue could still take place. Like, as I mentioned before, I was doing like one after another, like just so many, like maybe about 100 of these workshops over the year. But still, each time I do it, I realize so many people have never heard of what I have been saying before. So I know we still need to reach out to more people in order to fight against white supremacy. Like, that really is the shared kind of goal, right? So, and at the same time, I think that maybe thinking about what other things like, social media. I know, for instance, the CCNCSJ is now kind of working at a prototype to allow third-party reporting of hate incidents, right? So maybe that's something that we can also work together with. Sort of like I can certainly see like all of us would probably benefit from having this kind of a reporting app, because oftentimes these incidents are underreported for the reasons that all of the speakers have highlighted. But I think also we should kind of think of a better way of supporting each other causes. So let's say, okay, the government is going to host a national summit on Islamophobia. Then, okay, how do we make sure that the non-Muslim Canadians can contribute to the outcome? Like, sort of like whatever recommendations that come out, just like the Truth and Reconciliation Commission, what is it that the non-Muslim Canadians should do to support that? Like, so every opportunity we get, like, how do we bring an intersectional approach? How do we bring other communities in to the conversation? Maybe not at the stage where we define the solutions. I think the solutions probably should still come from the people who are most affected. But at the stage of implementation, then, what is it that all of us that have shared goal but may not have the same experience, how do we help with the implementation? So be more strategic, I think, going forward would be something that we should kind of think about.
Absolutely. So if the rest of the panelists don't have anything else to add to what Avi's already said, we might open it up for audience Q&A. So before we do that, Doly.
Could I just add one thing, Nizat?
Yes, please do,
So
Arif.
it was just this idea that I think it's really important that we get out of it builds up a bit upon what Avi was saying, but sort of getting out of our own little echo chamber and really reaching out to those people. And I will stereotypically, I apologize, say reach out to that long lost cousin on the prairies, that person that might not usually attend a CCMW event, et cetera. And I've been struck during this pandemic how vaccine hesitancy has come at me from all different sectors. People who are highly educated, not very educated, and I've tried not to be judgmental, but doing the same thing with issues like this and not being judgmental and even debunking something. And I say this painfully aware that I'm the only man on this panel, but even just debunking this idea that not every woman in a hijab is somehow coerced or forced into that hijab. Some women, lo and behold, might have made an active choice to put on the hijab, and it was an act of autonomy as opposed to an act of oppression. And just breaking it down for people, because they may have never even contemplated that in 1,000 years that could be possible until somebody talks to them about it. So it's just having some of those conversations. There's the allies that we need to prop up, but there's the not allies, but also not quite enemies who just kind of don't understand much of this stuff. That's where I think the real work has to be done. So I just wanted to put that out there, because Avi's right. It's only when guys like me with other guys talk about misogyny that we've made success. It's only when non-Muslim people are talking about Islamophobia that we've made success. Or all of us absent Avi talk about how bad it is, how East Asian people are being treated during the pandemic. Then we will make success when it's the others that raise it on behalf of the oppressed group. Sorry, I just wanted to add that in. Thank you.
Thank you. Very good point. Sorry, before I open it up to the audience, Doly, Iman, do you have other things to add that CCMW should be doing?
Sure, I can quickly just so many thoughts. Well, one of the things I would say is, first, you have been doing amazing work, and I thank you for that, because I know that you have also been doing work where you're influencing policies and making sure that government listens and focuses on things that maybe they're not doing a good job of. Recently, Bill 251, I believe, the human trafficking bill is one I would grab everyone's attention for and say, here's a bill where the government's saying that it's going to help people, especially for those from different marginalized communities. It's supposed to address a lot of anti-Asian hate or things where people from these countries who are trafficked and brought here. But what it does is it allows for police officers or constables the power to go and get full data on who stayed in what hotel on BIPOC communities. And this is going to be extremely dangerous and could be problematic when you don't have an oversight for the people who have access to the register, to the registry of these names and people who are coming in and where they're coming from, right? So there is a lot of legislations that are being passed or proposed. And I would say that CCMW and other organizations, I know other organizations are here, including BCS that I mentioned before, and all the different groups can definitely influence politicians and governments to make sure that we focus on legislation in a way where we understand what the consequences may be, and sometimes they're not intended to be that way. The other thing I would say is, here we are talking about, who gets a lot of the work kind of shouldered on, right? And we talked about the responsibility of us as women or Muslims, etc. But the fact that I have had so many of my community leaders or friends who are out there doing the work saying, I'm exhausted. I am so tired of being the one. And Avi talked about how she's done over 100 interviews, being that person. And as great as that is, it shouldn't be up to that person. It shouldn't be that way. If we first kind of dismantle the idea of othering, if we dismantle the problem that we have at its root, then we wouldn't have to deal with it in here. I think it was Arfa who mentioned, why do we wait until something big happens to tackle this issue? Why are we still not tackling Islamophobia the way we should? And there are some steps that are taken, but I think we need to do it even faster and make sure that we follow our words with action, right? There's going to be a lot of words, used and a lot of promises, but I hope that, people like myself and organizations like yours are able to make sure that we have real action taking place, so we never have to face certain tragedies like this ever again.
Okay, well, thank you very much. Unfortunately, we may have time for a couple of questions from the audience because we do need to wrap up. We have a hard end at 4 p.m. Really appreciated comments from all of you. Those were really thoughtful and helpful comments and ideas about how to move forward. Are there any, so like I said, we can take a couple of questions. If you want, you can use the raise hand feature from the reactions button at the bottom. And I'd be happy to, and let us know whom you want the question addressed to, please. My goodness, there are lots of comments, really good comments in the chat. And Arfa, I really like this point that you make. Why is it that we as a community wait till the damage is done? So this idea of being proactive, all the things that we talked about, we had SARS. We went through this, through a pandemic not too long ago, and we forgot everything that we learned, from that. And I know that even the Public Health Agency of Canada came under scrutiny for not being better prepared, So I think now we have so many lessons. And maybe it's time to start planning now. I'm sure the agency is working on, prevention measures and how do we treat this other epidemic of racism, that we're contending with constantly. So thank you for that. Here's a question. How do you speak on the fact that some communities do not believe that the virus is real and believe the conspiracy theories, especially about vaccines? That's a very good question. And there are communities that don't believe that the virus exists. Arif, do you want to take that call?
Sure. Yeah, I think it's probably. I'll try and take the first stab at it. It's an important question. It's unfortunately a reality as things have started to open up. I've had more and more actual in-person discussions with people outdoors, and I'm finding this with uncomfortable frequency that issues like this still arise. The best thing that I try and do as an elected representative, and people who have different strategies, is I try not to be judgmental. I try and just sort of probe a little bit about where people are getting their information from. I try and direct them as best as possible to areas where we can find some common ground, sources that they would deem authoritative. And I try and also emphasize, it's not meant to be a psychological trick, but usually the same people who express that hesitancy also express some anger about lockdowns and rules and why isn't this open, and et cetera. Why can't I go to my favorite restaurant and drink beer, et cetera. And I sort of say, well, the two kind of go hand in hand. You can play your part by observing the public health guidelines, including ideally getting vaccinated, because when those numbers rise, the rules start to and restrictions start to reduce. So I try and sort of come at it from different perspectives, but unfortunately, disinformation and misinformation are a part of our reality. They apply to geopolitical conflicts. They apply to pernicious racist stereotypes. They apply to things about the vaccine. We'll never cure all of it. We can try and tweak some of the tools, but it's about sort of having some of these conversations and trying to just get people to discuss it, not feel judged, and maybe turn to people that they would otherwise trust. So I often try and encourage people to go to that family doctor that you've been seeing for the last 10 or 15 years. If you don't trust it from my politician's mouth, maybe you'll trust it from somebody else's perspective. So those are just some of the attributes I try and raise. And that made me think about one other thing, Nusrat. I apologize for digressing, but it's interesting that while we're dealing with addressing stigma, I've taken some pride from the fact that 3 out of 4 or 4 out of 5 of every public health professional happens to be a racialized person during this pandemic. So right. I think that's a good thing as a racialized person, but maybe for other people, that's just fueling their perceptions that they're being misled and taken down a garden path. But I wear it as a badge of pride. But I just wanted to throw that out.
That's absolutely the case. So Iman, last response, and then we're going to be wrapping up. Thank you so much. Go ahead, Iman.
Yeah, I just wanted to quickly add into what Arif said about access to information and where people are getting their information. From my experience in the Air Ethio COVID Fund, a lot of the people who we were engaging with who were applying to the fund, we found that they couldn't access the information because a lot of the times they didn't speak English. And a lot of the information surrounding the pandemic is in English. And so we have, I'm sure everybody has been a part of the dreaded WhatsApp chains of information about the pandemic. And sometimes what they're getting in these, WhatsApp groups or from other people in their community are coming in their own languages. And so I think people are more, if they don't speak English, a lot of the times people are more willing to believe what they're hearing from people in their own communities rather than information that doesn't make sense to them. And so I think a big thing is having translated documents, and that's something that we've been trying to do in our initiative. Like when a lot of the restrictions came about, stay-at-home orders, we tried to translate this information and disseminate it within the communities so that people understood what were their rights during these stay-at-home orders, and that they weren't in a confused place.
Excellent, thank you. Lots and lots of great ideas and comments. Hiba, really quick, please. Thank you. Go ahead.
Hi. So I just want to kind of make a little bit of a note, not to sort of like, I'm by no means a conspiracy theorist or an anti-vaxxer or anything like that, but just to, have a little bit of, I would just maybe caution towards kind of patronizing people a little bit who have questions, because at the end of the day, like the vaccine is still new, it's not FDA approved, and there hasn't been a lot of time. So there's very valid reasons why a lot of people are hesitant. So I would just kind of caution towards maybe, just kind of speaking about racialized communities and their hesitancy towards something that's new and hasn't been tested for a long time. So I just wanted to say that.
Thank you. Very, very important point there as well. So thank you all for joining us this afternoon. I know it's the middle of the week and in the middle of the afternoon and on a rainy, stormy afternoon in Toronto. And of course, our sponsors today are the Toronto chapter of CCMW. So back to the president of the chapter, Fatima. Thank you.
Thank you, Nazat. So just a couple quick general takeaways to wrap up all of the very wonderful and thought out responses from our panelists. The first is to create equity across all institutions, to increase representation across all levels of government, so diversity of lived and shared experiences can help shape future policy. Third, language is important and all institutions should and need to recognize that. Fourth, the targeted universalism to ensure there's equal access to resources from the government and other NGOs is an important strategy. And that affinity partnerships, allyship, and collaboration across all minority and vulnerable groups will help us get this very important work done. Lastly, I just wanted to highlight the website that AV had mentioned at the very start of this event to report racist incidents and hate crimes around COVID. Please visit covidracism.ca. And lastly, for more information about CCMW and how to volunteer, get involved, or become a member, please visit ccmw.com and be sure to check out www.daretobeaware.com to learn about our digital anti-racism education workshops. Thank you so much to all of you for attending today. A very special thank you again to our panelists, Doly, Arif, Iman, and AV, sorry, for all of your wonderful thoughts and sharing with us the best ways to move forward and really combat racism and stigmatization that we saw during the COVID-19 pandemic. Thank you, everyone. And I hope you all have a wonderful rest of your day and the rest of your week.
Thank you.